have two guests talking about cancer. It's not a very pleasant thing to talk about, though.
Very technical as well, but we hope there's a medical doctor among them, and we hope that he will be breaking down the issues for us. So we have Dr. Ndinka Fitzgerald. He's the medical director of Celebrities for Africa. It's an NGO, and we'll be knowing a lot more about that in a moment. And just besides him, there's Mr. Ning, who is the Cameroon representative of the NGO. So welcome, gentlemen, and Happy New Year.
Happy New Year.
We still say Happy New Year, don't we?
Wow. We're still in January.
So the first thing I want us to find out about, maybe I'll ask Mr. Ning Elijah, what is Celebrities for Africa about?
Okay,
is it celebrities coming to do something in Africa, or whatever?
Thank you, Pachi, for that question. Celebrities for Africa is a non-governmental organization that was created in 2009 in the United States of America by Cameroonians and Americans who work in the cancer community. And they created this because of the alarming facts and figures that emanate from Cameroon and Africa. We should first of all agree on one thing. Cancer is not, as you said, a pleasant disease to talk about, and that's why we have avoided it. And 99%, we're just from talking to Professor Doe Anderson, who is the permanent secretary of the National Cancer Control Committee. It's 99% of cases come to hospital at a terminal stage. So this concerned philanthropist created the Celebrities for Africa to create awareness so as to lead to prevention. Since people are not aware of what is at stake, lead to prevention, which is the best cure for cancer.
Like for any other disease, you know, it's.
Dr. Ndinka, tell us, what is cancer? Let's start from page 1. You know, what is cancer and...
Well, the main issue is we need to bring awareness of cancer to the layman public. Yes, so cancer in itself, it's a group of diseases characterized by cell growth which is uncontrolled. Cell growth is uncontrolled, and if it's a normal cell which has to divide, I mean, it replicates, it divides, and then at some point in time, it has to go through a death process. It's an automatic death process. They call it apoptosis. A cancerous cell doesn't do that. It just keeps on growing and growing and expands, and that is where this whole maybe lump, tumor, gets formed. Except maybe a blood cancer, it has a totally different process. So I think we will go through.
Maybe
the
we'll just go straight to
the slide, yes,
the slide so that
and we will present.
We understand exactly.
So just explain, maybe as we go through the slide, what we're seeing.
Yes, so go to the next. Yes, this is, we see the growth of a normal cell and a cancerous cell. If you notice, the cancerous cell has uncontrolled growth. It doesn't go through a death process like the normal cell. It just expands and expands, and it's uncontrolled. Go to the next. So we have to differentiate. There are two types of, let's say, tumors. Normally, a cancer is a tumor. But when we classify tumors, you have the benign tumors, which are
not cancerous.
Not cancerous, yes. But depending on your localization, they could be cancerous. Then, no, let me not say cancerous. They could be
dangerous.
Dangerous, yes. Then we have the malignant cells, which have a division which is more or less uncontrolled than the benign cells, and they could enter into the blood vessels or through lymph vessels. They metastasize to different organs, and that is why they are dangerous. When they grow, their growth is expansive and invasive. So that's what makes it more dangerous. So facts we should know about cancer. Everyone can suffer from cancer. When detected at an early stage, cancer can be stopped and completely treated. Cancer is difficult to treat once it has spread to other parts of the body. I have to make this clear anyway. Sometimes some people don't get to know about their cancers till it's really late. That is the one thing which makes cancer very difficult to treat. Most of the people who get to know about cancers, they get to know it at a terminal stage. So
let's find out, how do you know that the simple growth that you have in whatever part of your body
could be cancerous?
Could be cancerous.
Well,
because that is where the issue is. They don't go to the hospital because you can just find something growing on any part of your body and you think it is just a growth.
Yes, that is where the problem is. That is why we have to make them aware of all these different cancers. We tell them, you go to the hospital regularly. It's checks once a year or twice a year, And it's usually during the systematic checks that those who have had cancer already get to know they have a cancer.
Yeah.
That is where they, I mean, in big cities where they're more exposed to diagnostics. Generally in the villages, what happens is these things happen and they claim it's a witch doctor or the mother,
some
uncles
witchcraft
and
kind
stuff
of
like
thing.
that. Yeah.
So what the different types of cancer that we have?
Yeah,
Which are common in Cameroon.
In Cameroon, we have, I mean, the ones which are really predominant. We have cervical cancer, breast cancer, prostate, lung, colorectal, and liver cancer. So, as we all know, January is World Cervical Cancer Awareness Month. And I think we have, next week, we have cancer...
World Cancer Day.
World Cancer Day, yes,
Day.
next week. Okay. So we'll start with cervical cancer. As we could see, we have an infected, we have an infected cervix, and we have a normal cervix that is viewed through a speculum. When we, the stage 1, there's a normal cervix, and you see the infection process starts growing at the tip of the cervix, and it starts invading till it gets through to the surrounding tissues. That is the stage 2B. Generally, at that stage, we have abnormal vaginal bleeding. We call it contact bleeding. Let's say if a girl has sexual intercourse, for some reason, she could have abnormal bleeding and pain. Longer and heavier menstrual periods, pelvic pain, and increased vaginal discharge.
So they should watch out for that.
Yes. Causes of vaginal cancer. The most popular known is the human papilloma virus. So generally, when we talk about prevention, we already have this awareness program going on in town. With the Baptist Church, they go around, they have vaccines, HPV virus vaccines, which they give to young girls of, from maturity, 18 years up. So then you have genital warts, usually called condylomas. Prevention of cervical cancer, yes. As I said, HPV vaccines, avoid smoking. Statistics show that women who smoke are more prone, predisposed to cancer than those who don't smoke. Nutrition and exercise.
A whole of other things as well.
Yeah. Nutrition and exercise, awareness and screening. So we talk about breast cancer now. You can see the picture of breast cancer that is on the breast tissue and the lymph nodes. Symptoms of breast cancer: abnormal nipple. Yeah, usually the nipple is involuted, that inside. It turns inside, and then you see a change in the breast size. When with the tumor growing inside, it becomes larger and it's harder. A lump in or near the breast, and an inflammation of the breast. Usually, like if you take an orange, you see the back of an orange, that is how the breast becomes, like with a lot of dimples inside. So you could easily get to know if, you could suspect a cancer from that. Then detecting breast cancer, the most important, become breast aware as from 18 years. There are measures which are taken for girls from 18 years, which go to normal screening maybe once, let's say once in a month after the menstrual period. Yes, they say you examine monthly. You stand in front of a mirror or lie flat on your back, and then you start making circular movements.
Dr. Dinka, we might not have time to go through all the slides, but I think
it's important for us to know those that we are more vulnerable to in Cameroon, especially, and we like know the 6. The 6 that are most common in Cameroon.
Oh, we have cervical cancer, lung cancer. We have prostate cancer. No, it's about 4 of them. We have prostate cancer and we have breast cancer.
All right.
Yeah. And one thing we have to know, it affects men also, because we talk about breast cancer, but we never put men inside. Men are also prone to having breast cancers.
Okay.
Prostate cancer is the same thing. From about 40 and above, there's a lot of men now having prostate cancer. So that is also very important to know. More than 90% are caused by cigarette smoke. That is lung cancer. Although there are a lot of people who can suffer lung cancers without even touching a cigarette.
Secondary smoking.
So preventing lung cancer, stop smoking, that is the most important part of it.
Right now, tell us, we don't have much time left. How do you intend to go about this campaign?
What are your activities and where?
Well, we have started that already. We did some schools in the Faku division. Yes, and with time, we're going to spread. I think we have a program. We're going to go through the different provinces. We're trying to increase our arsenal of doctors. So if somebody is wishing to apply, we have celebritiesforafrica.org. I mean, we are looking out for doctors who can help us in the different regions to reach out to the populations they have.
Voluntary doctors. They should not say they need to be.
I would just like to add something. This is part of what we call Cancer One project. Okay. The Cancer One College, please. The Cancer One College wants one thing. For example, look at the presentation. I'm a teacher by profession. He's a medical doctor. We are communicators. We have just touched about 2 million people or more.
You're right.
And what is happening is this. If we come together, professionals from all walks of life, and mobilize and come out with strategies and messages. Imagine we get to a traditional meeting and we discover that women of 50, 60 are suffering from this thing without knowing. So please, what we are doing is mobilizing resources and people from all walks of life to really make this thing very well known, so that people should really start adopting the good habits. That's the most important thing.
I want to think that for stage one, the message has gone through.
And we'll look for more opportunities to talk about them. All right. Thank you so much, Dr. Zinga, and thanks to you, Mr. Ning.
Thank you.